So I'm just going to briefly cover the reimbursement for non-VA emergency medical expenses. So for veterans enrolled in the VA healthcare system, over my 10 years doing this, many veterans are confused about what if they have a medical emergency, heart attack, fell from a tree, broke their leg doing housework, whatever it may be, and they have to go to the nearest non-VA trauma center to get care. How will VA consider paying those emergency and medical expenses for you? So that's what we'll be going over today. So you'll see right here, VA has two legal authorities that cover reimbursement for non-VA emergencies. The first one is under a code called 1728, which is all around service-connected injuries, service-connected. If you have a service-connected disability, what the rating is, that's the first law they'll apply when trying to figure out if they can pay this medical bill. Under the next one, which is 1725, this is non-service related. A veteran doesn't have to have any service-connected disability at all, and have an injury and still have the VA consider to pay the bill or partial payment towards the bill. So I'm going to talk a little bit about these, how they break them down, and how they can look at considering these. So on the first one, on USC, it stands for 38 United States Code 1728, which is a law. VA will consider payment if a veteran is entitled to cost-free VA health care, but they have to meet these requirements. So you'll see on the first one, medical care was provided in a medical emergency and such that veteran was reasonably expected that delay in seeking immediate medical attention would be hazardous to the veteran's life. 2, so the first one is your opinion if it was a medical emergency. In a prudent layperson's opinion, was it a medical emergency for you to go somewhere? The second is the services were provided to a veteran in need of care for, like I said, under 1728, it all revolves around service-connected disability. Did that medical emergency that caused you to go into the ER, was it due to a service-connected disability? That's the first block. The second is non-service-connected disability that was aggravating a service-connected disability. So basically, for the reason for which you had to go to the ER, did it aggravate a service-connected disability? And if so, they could possibly look at paying for that emergency care underneath this law here. And then, of course, for any veterans out there that are 100% permanent and total rating from the VA, service-connected, if they have any medical emergency for any reason at any given time, they would qualify under 1728 here, under that bullet point. And then lastly, this won't apply to too many, but at least not here, but for our veterans, maybe our younger veterans, veterans participating in the vocational rehabilitation program. And Jim and I were just talking about this the other day. Jim and his team work closely with vocational rehabilitation. It's called through the VA right now, Veterans Employment and Education. And it's basically veterans that are, they got an injury in the service, they file a disability claim, they get a rating of at least 10% or greater, and that disability prevents them from gainful, sustainable employment. Because of that disability, they can go to college for free under Chapter 31 Vocational Rehabilitation Program, and it trains them in a career field that they can do with their service-connected disability. That's what I went through when I was retired from the service. And so any veteran on that program that's partaking in Chapter 31 with the federal government, if they have a medical emergency and they go to a non-VA, VA will cover their bill under 1728. And then lastly, out of the 3, VA facilities were not available and an attempt to use one would not have been reasonable. So this just kind of breaks down those three a little bit further. Now, when you talk the medical emergencies, you can see that it says it's not what a doctor, a licensed physician, considers what emergency is, but it's just a prudent layperson between you and I. Is it emergency? Do you think it's an emergency? That is good enough. That meets the definition of medical emergency. You'll see that right here. Does a prudent layperson, non-medical expert, consider the situation to be emergency? So that's the whole number one, medical emergency. You have to make that determination. If you, oops. Two, again, it just breaks down the VA facilities. Urgency of the veteran's medical condition, distance of the travel of nature of treatment required makes it necessary to use public and private facilities. And then lastly, throughout this process, VA will only consider, if you met one of those we just talked about, VA will only consider paying that bill, that hospital bill, up to point of stabilization. And you'll see that under bullet point 3 here. And what that means is that the government's not going to continue to stay in that hospital when you have been stabilized and you can be transferred to the nearest VA facility. I'll take a break now. Does anyone have any questions about 1728?
Oh, but Jeremy, what about myself up in Grand Rapids with community care? And I have to go to the local hospital. Will they transport me to St. Cloud?
So that's a good question. So when you go through this process here and you notify the VA, and we'll get to the next process about notifying the VA. There's a certain time frame for which you got to notify the VA.
72 hours, I believe.
Yeah, I don't know if, did I cover that in here? I thought
No,
I did.
I've got stuff.
Okay, I think it's coming up. But yeah, so for you, for instance, once you report that, they'll find out if there's not if the VA is far away for you to be transferred and it's not reasonable to transfer you, they will continue to pay after the point of stabilization. Also, if there is no room to accept you or they just can't accept you for any reason, they can continue to pay that medical bill after point of stabilization. So that's a good question. They will make that determination. Once you report it, they'll be working with that ER facility to get the
It's sometimes those.
Yeah, they get an explanation of benefits. I think it's they talk between each other, so they can make that determination.
There's two different hospitals up here. One's belongs to Essentia and one's Grand Task, and I deal with Essentia, and
Okay.
their one hospital is about 18 miles away, Essentia, and the major hospital is up in Duluth at Essentia St. Mary's.
Gotcha.
Jeremy,
Yep.
how does this work with Medicare?
So yeah, we'll get to that, Jim. I appreciate you bringing that up. We'll get to it here shortly. Is that okay?
Absolutely.
So throughout this process, if you feel like you qualify under those because you're 100% or it's a service-connected injury that caused the emergency, VA will then reimburse you. But typically, you don't have to file the claim for reimbursement, which it states here you have 2 years from the date of the treatment. That typically is not needed because through the communication within notifying in 72 hours, VA is already tracking that, and they're already going to get the explanation of benefits requested from that provider, and they're going to already start initiating paying those bills once that provider is submitting them to the VA. But if it doesn't happen for some odd reason, there is a form, which we have there, VA Form 10-583, and that can be filed for reimbursement for any costs that ER provider billed you, and then you can send that to VA to be reimbursed by VA for those costs. But typically you won't have to ask for reimbursement because if you need, notify VA properly, they will just make the determination through 1728 or 1725, which we'll talk about next. And if you do qualify, they'll work with that provider to ensure that they're being paid. So next, let's talk about, this is the more popular one, United States Code 1725, also known as the Mill Bill or Millennium Bill. And this was created basically for veterans that, you know, do not have any third-party insurance. VA is their only healthcare provider. They don't have service connections. And the reason why this was passed is to ensure the veterans enrolled in the VA healthcare system have their emergency room visits covered. So generally VA looks at 1728 first. If that doesn't apply to you, they'll go into this 1725. And so 1725 right here, it says VA will reimburse a veteran or provider for the reasonable value, and Jim, this is Medicare rates of emergency treatment provided to the veteran in a non-VA facility if the veteran is personally liable for the treatment and is an active participant in the VA healthcare system. So this doesn't specifically answer your question, Jim, about what if I have Medicare and I'm covered under Medicare. But what this does is, what this says is that anytime VA is responsible under these laws to pay these veterans ER bills, their reimbursement to those private providers are at the Medicare rates. So what I've seen in my 10 years is a lot of these providers in the community will seek the veterans' private insurance out because they can get a higher reimbursement from their private insurance if they have it, even though the veteran notified them, I'm enrolled in VA, you need to bill VA first. Because if the veteran's qualified under one of these two laws, VA is the first payer on the bill. So that's just something to think about there. So again, this just repeats what was required under 1728 as well. Medical emergency and the VA facilities were not available. An attempt would be not reasonable to go all the way to a VA facility. So next is what does personally liable mean? So is financially liable to the provider of the emergency treatment. Private pay, including Medicare, doesn't cover the total cost except for deductibles, co-payments, or co-insurances. So what that means is that if, let's say, a veteran doesn't have any third-party insurance at all, and they're not qualified for Medicare at this point in time in their life, all they have is the VA healthcare benefit. So under 1725, they would cover that ER bill. Now let's state, like Jim says, let's say that they're of Medicare age, they have Medicare, and that's their only third-party insurance. Will VA consider making that payment before Medicare? And the answer is no. Medicare, under 1725, the third-party insurance will make the first payment, will be the first payer. Anything left over that Medicare doesn't pay, except for deductibles, co-payments, and co-insurances, VA is responsible to pay that leftover bill. Does that make sense?
Yes, thanks, Jeremy.
Jeremy, insurance besides, I carry TRICARE besides Medicare and VA.
And I'm sorry, your question was, you kind of broke up.
Well, I'm covered. This is just a statement, Jeremy. I've got the VA, TRICARE and Medicare besides the VA. So I'm fortunate enough to have extra coverage.
Right. No, yeah, it sounds like you're set up pretty good with multiple coverage plans, but unfortunately, a lot of veterans only have, just the VA healthcare program. Sometimes, like I said, they're not of Medicare age, and VA is their only provider for medical care. And so in an instance where they have an emergency, if they have no other private provider, then VA should cover under this law their medical bill up to point of stabilization. And again, if they do have a third-party insurance, like let's just say, well, I really can't use myself, for example, but just anyone that has like Blue Cross Blue Shield, Health Partners, but also is enrolled in VA. Let's say that they have an emergency, they go in the community, and the community ER bills their Health Partners. Health Partner doesn't cover the full bill. Let's say for some reason your plan for ER visits doesn't cover the full bill. And we're not talking about the deductibles, co-payments, or co-insurances. We're talking about the main ER bill and anything that's included in that cost of care. If there's a portion of that Health Partners does not cover, then we submit the rest of that bill to the VA, and under 1725 by law, they have to cover the rest of it. Does that make sense?
So Jeremy, does that Matt happen anywhere in the country? Because if you like right now, I'm out of state.
Yes, sir, Joe. This is VA law. This is 38 United States Code 1725 applies to Veterans Health Administration. This is how they handle all veterans ER in the community. This is just one of three we're going to cover. Go ahead.
So I'm on vacation or I'm on the road to vacation. The same system works.
Same system works. Yep.
Okay.
And I'm gonna cover a third option that makes things even a little bit easier and a little bit better for everyone. And this was just a brand new update in the regulations as of 2018 and implemented June of 2019. So when I get to this, you'll take a deep breath and you'll say, oh, I don't have to worry about these two laws, service connected one or non-service connected one. VA makes it a little bit easier because of the advocacy the American Legion did through some legislation a couple of years ago. So lastly, obviously a veteran needs to be an active participant in the VA healthcare system. So I have 24 months, but typically I think VA wants to see you enrolled at least, or excuse me, you have been seen once within 12 months to be considered an active participant. So again, any of these, if you don't meet, VA theoretically by law can deny paying your bill. So for reimbursement, if you had to do it that way, you have 90 days only to file this reimbursement from the date of discharge from the facility, or from the date the veteran exhausted without success action to obtain payment or reimbursement for the treatment from a third party. And then again, it's the same form, the 10-583 form. And that application, like I said, is 90 days. Your CVSOs, your county veteran service officers, obviously myself, we all know how to submit these if we need to get reimbursed, if the veteran needs to get reimbursed for this cost of care, because either they had to pay for the private provider, or excuse me, their private insurer, or they paid out of their pocket. And then you can submit that form to the VA for reimbursement with all the proof.
Jeremy,
Yeah.
do we need to notify the ER when we get there that we're a veteran and we're in the VA system to have this happen?
Yep, exactly. And so I'm going to get to that. And I'm sorry, when I was putting this together, I could have had it earlier in there, but I'm about to get there to it's at the next slide. It's on the next slide that will talk specifically about, all right, now what do I do in a real world? I'm going to the facility. Who do I speak to? How does it happen? Right now, I'm just kind of giving you guys the general legal laws that VA has to follow to consider paying. But when it comes to real life stuff, we're about to get to that, if that makes sense. Is that okay?
Yeah, that's fine.
So
Thank you.
Yep, no problem. And so recently in 2018, you'll see here on this slide, for many years, even when I started in 2010, VA was determining and denying paying leftover bills after Medicare had made partial payments on ER visits under 1725 here. All the veteran had was Medicare. That's it. And VA healthcare benefit. That's the only two things that the veterans had. And if a veteran had an ER visit and they had Medicare, VA was interpreting the law incorrectly. The law changed in 2009 where it said, even if a veteran has Medicare and Medicare makes partial payment, VA by law has to pay the leftover portion. It wasn't until 2018 in a class action lawsuit out of a guy here in Minnesota where we had VA held accountable for not paying on these claims after Medicare had made a payment. And so this is a huge win for veterans. Up until 2018, if a veteran had Medicare and they made a partial payment, VA was denying. Nope, Medicare already made payment. We're not covering any of it. Now today, you could have any third-party insurance. You could have Medicare. If they only make partial payment, you send the rest to VA. This includes emergency transportation. So now we get into the recent change under the VA Mission Act, which expands ER coverage to in-network community providers. And this is just of June of 2019 when this was enacted. And so what this really means is that, have you guys all heard about VA's community care program, right?
I'm in it, Jeremy.
You're in it. Okay.
Yep.
So VA has a community care program for veterans that have a long travel time to the nearest VA facility, or there's long wait times to access care in a VA facility. If they meet any of those requirements, they can go ahead and get a consult for care in the community to go to an in-network provider in the community. And what that means is in-network is that you guys heard of Optum Health Group, I think it is. Optum had
Yes.
taken over as the third-party administrator for all the providers in our region. And so Optum has a very vast, large, list of providers to go to. So what this law states is that if a veteran goes to an ER room and it happens to be on contract with VA and Optum as a third-party provider in the community, that they will cover the bill. Not going through those first two laws, but under this new regulation for care in the community. But what you do need to do for all of them is notify within 72 hours. You won't have to really worry about the claims filed within 180 days. It does have to be, of course, a layperson's definition of an emergency. And then all of their VA facilities were not feasibly available at the time. You got to be considered a covered veteran, which is an active participant in the VA healthcare system, which means you've been seen at least, like I said, it did say 24, but at least once a year is preferable. So your annual physical or whatnot. Eligible entity or provider. So that's what I'm talking about. They have to be on contract in network with the VA and Optum. And if they are, and you follow those steps, notification, 72 hours, you've been seen at the VA once within the year, they should consider covering the bill fully and reimbursing that provider since they're in network. There's three ways of reporting your 72-hour notification to the VA. This is the most important part. And this is what you should share, with all other Legionnaires and veterans, your district, is that don't worry about the laws. You just report it and let VA do its work. And if you feel on the back end they made a bad decision, you contact someone like myself that knows the laws, and we can see if they made the determination correctly. And if we have to appeal it, we can. But this is what you need to tell them. If you have an emergency room visit, you notify the VA within 72 hours. You do it by this new portal that just got released last week, which is here. It's called the Emergency Care Reporting Portal, ECR. We'll take a look at that in a second. Or you can email the VA at this email right here. And then also they have, let me see here. They also have a phone number. I don't think I put it on there. Where do I got it here? Here it is. Do you guys want to write down this phone number? This is an important phone number to have.
And this phone number is for what again?
This is for reporting any kind of emergency room visit to the VA within 72 hours.
Okay.
Now, theoretically, by law, VA can deny paying those bills if you failed to notify the VA within 72 hours from your emergency. So this number is 844 724
724
742.
7. Run that by us again.
Jeremy?
Yeah, that's 844 724 7842.
Question,
Yep.
covered veterans, is that a 100% requirement, or someone like myself is 10%?
Nope. This is this last regulation here that we're going over under the Mission Act, this regulation for care in the community. This is for all veterans.
Care in the community, yeah.
Yeah, this opens it up. Those first two laws we talked about, 1728 for service-connected people, veterans, and the other one, 1725 mill-bill people that are not service-connected, have no other health insurance plans or minimum health insurance plans that only cover a little bit. Those are two laws VA's always had, and that was the only way they would consider paying emergency bills. You had to fall under one of those two, and if you didn't, you're on your own to pay that bill. But now, as of just last year, they updated emergency room visits to cover emergency room visits if that provider is an in-network provider.
Okay, so and VA would fall into like the second or third payer, if need be.
Nope, under this law right here, VA is the first and primary payer.
Okay, 'cause I'm like Bruce. I have TRICARE, plus I have TRICARE for Life, plus Medicare. So
Yep.
those are the first two. Presumably.
Yep, under this regulation, that doesn't apply.
Okay, so if I have to go to the emergency room, I just put all 3 ID cards and say, take care of me.
Wait, yeah, right.
Nope, I wouldn't even do that. I would just tell them that you're enrolled in the VA and that
Paul.
you got to notify the VA within 72 hours, and you can do it either by that phone number there, this email here, or this portal here. And if you notify, and I'll show you what the VA is requesting during this notification period. But yeah, if you provide your other health insurance, what may happen is they may end up billing that health insurance, and then what happens then is now you're left with possibly a co-payment, right? So we don't want that to happen. If VA is going to automatically cover ER bills, all ER bills, if it's an in-network provider that provided that emergency room visit, then send it to VA and let them cover that bill. So I'm going to just click on here so you can see this. And I don't know if I can make this work or not. I don't think so. Shoot. Can you guys see this next slide here?
The VA locator tool.
Yep. No
I
one
got
of
it.
it. So I'm trying to get these links to come up. Jen, do these links typically come up on the Zoom?
I think it just did.
Can you guys see this? What's on the screen here?
Um,
Or is it still just the?
It's still just a slide, Jeremy. You'd have to move that window
gotcha.
in front.
Okay, here we go. Here it comes.
There you go.
Can you guys see that emergency care reporting tool?
okay. Yes.
All right, so what I did is I just clicked on that website that I provided for the portal, and it brings me here. Now, I can just play around and put some stuff in here real quick, and let's just see. So obviously they want to verify you are who you are, so they want an email reporting as a veteran representative. I'll just say I'm a veteran doing it. They want you to do this. Yep.
You better
Alright.
pass that. No.
Yeah, exactly. All right. So now it looks like they sent me an email, and this is brand new. So it just came out.
So you sent the email in already. Okay.
Well, no, yeah. So it says you have been sent an email. So I'm just waiting for it to come to me. There it is. Here is your link to the emergency care reporting form.
Oh, okay.
So let me see if I can pull that up quick and share it with you. Just waiting for it to populate on my desktop email here so I can open it up and share it. Okay. Okay, are you guys seeing my email here? Right here?
No.
You've got to share that on the same screen as overlapping, Jeremy. There you
Okay.
go.
Okay, so here's my email. It just came in. See what it says here? Vet VA email or VA emergency care reporting link. So I'm going to click on this. Don't tell me I got to share this screen too now, huh?
Yep.
All right, we'll get there. Hold on. I'm learning as I go. All right, so now do you see it?
Not yet. Close the email one.
Oh, hold on. Here we go.
There you go.
I see there's a green box around it, so it tells me it's on it. All right, that's good.
Yep.
So everyone taking a look at this here?
Yes.
It looks like they're asking for some good information. So your general information here, social, home address, healthcare provider information, just put the VA, St. Cloud or Minneapolis, episode information, time zone, date, time, scene, mode of arrival, ambulance or other. Where did the injury event occur? And it looks like you submit it. And once you submit it, now it's in the VA healthcare system. You've done your job by notifying the VA within 72 hours. Now they're going to get the details of the emergency. They're going to have your veteran's health record to see which priority group you're in. And if any of those, if the ER was service, first they're going to look at, was it an in-network provider? If it was an in-network provider, that's all they need. All they're going to do is work with the provider now, and they're going to cover the bill up to point of stabilization, and then that's it. It's going to be that easy. Does that make sense?
I can see where the telephone number is going to be the handiest, because if you're sick enough that you had to go to the ER, you're probably not going to have a laptop or your iPad to email that information in.
Exactly.
Just a thought. So I can see where the phone number is going to be probably the real important item.
Well, and I think that's why it's important that the people, your loved ones or your spouse or whatever, know where this website is so that you don't have to worry about it, so they can jump on and do that while they're waiting, for doctors or whatever. Unless it's a major crisis and yeah, you want to call, but overall, if you have somebody with you, they can be doing that.
Good point.
Yeah, that would work for family members on the filling out the form like that, because they should have all your information. I'll use my episode as a prime example with that tractor wrestling incident a couple of years ago. Couple of the family members beat the helicopter to the hospital. And it was a non-VA hospital because of the trauma, because Sioux Falls VA does not do trauma. So they go to either one of the hospitals in Sioux Falls.
Well, and the other case is like my dad who lives in Maine. So if my mother called me and said something to me about it, I would be able to go on this site, put his stuff in, and they'd be notified, and my mom wouldn't have to worry about doing it.
Exactly. Doesn't need to be the veteran.
Okay,
The provider should be getting this information too. All the in-network providers, at least through Optum, they should all be getting that reporting portal information. It's something they get trained on as well. So they should be familiar. If you say, I'm a veteran and I'm enrolled in Minneapolis VA healthcare system, we got to notify them with 72 hours. Most of the time, they'll do it on your behalf. But you want to make sure, obviously, that they're doing it. They've either called them, they've went on the portal, or they sent them an email. Can everyone see here back on the PowerPoint?
Yes.
Jeremy,
Yes.
can I get that email for the
Portal.
notify the VA? It's covered up. It's covered up with faces.
Yeah.
I'll email it to you, Bruce.
Thank you.
Would you do that for all of us?
I will.
Thank you. I like that idea.
Are you gonna send the PowerPoint out to everybody?
We'll put it up on the department website.
Great, thank you.
I just want to show you guys one last thing here that I think a lot of veterans find they don't know about it, but it's something that VA does have available. Let's see if I can get it to come up here real quick, and then I'll share it. Let's see here. Yeah, for some reason it's not working. Shoot.
Jeremy,
Yeah.
is there a way to find out which one of these places are in network with Optum?
That's a good question, Brad.
Brad.
Or wait, excuse me.
You were
who was
close. Same district.
Who is
different guy. Randy.
that? Oh, my bad. So no, that you would think that, hey, come on, this would be a useful tool for veterans if VA is covering ER costs, if it's an in-network provider. Well, what I was about to show you right here, are you seeing my find VA locations, right?
Yes.
Yeah.
Let me see if I can get it to come up. The link is it's coming up and then it's going dead right away. So let me see if I can so in this link right here, that's what I'm going to be working with National on, trying to get them to convince VA Central to add that as an option, is to find in-network locations for ER visits. I don't know why they didn't add it. And then when you go to Optum's website for veterans healthcare, for community care under Optum, they do have a list of in-network providers that you can check on, but it's inactive currently and it's a work in progress. So that could be, it's been pending that way since last year. So it's just not very helpful. And I hate for veterans to take a guess whether that ER is in network or not. It would be nice and helpful to know that which ones are.
The reason I'm asking is that some of the current veterans have a choice in our location in the second district to go to say Madelia, Fairmont, Albert Lee, Blue Earth, all these hospitals, and within 60 miles. So if we had a list that they would be able to go to the county veteran service officer, get a hold of for us or to learn, they would know to go there instead of taking a chance.
Right. Okay. So I got this link to pop up. You guys seeing it?
Yeah.
So right here, does anyone want to use their address? Not really. I can use my address.
Yeah.
Jeremy, punch this one in.
Okay.
2655 Linden, Linden Avenue,
Yep.
Slayton, Slayton. And the zip is 56172.
So
it should pop up Sioux Falls and St. Cloud.
right. And so look at, so now you go to facility type. VA, urgent care provider in the community for like pink eye and all that stuff, urgent care that's in network. Then you got community providers in VA's network. Remember, that's what we were just talking about.
Right.
Those that have agreements with Optum as a third-party provider, those are considered in network. But what they don't have, when you click on that, is an option for ER visits right here. So you have to type in the type of specialty care service you're seeking. And it's got like example of chiropractor and optometrist. But if you put in emergency room or like, let's see here, emergency, whoops. Spell.
Emergency medical technician, paramedic,
Yeah,
intermediate.
There's nothing
basic.
in here.
Right
There's
there's
nothing. There's
Emergency medicine. That's what they got it titled as. That's weird.
Yeah, I mean, so, and then it breaks down where right here on the side, it doesn't give the name of like the provider, just the name of an individual that provides emergency medicine. That's not an emergency room. So what I'm
Okay.
trying to say is it makes it really difficult.
Actually, Jeremy, emergency medicine is your emergency room department. So if you're going there and then you're waiting to be stabilized to determine whether they are going to continue to pay or not, that's where you'll start. If you go in an ambulance, you're going to go into the emergency medicine. That's the first go around. And then they decide what's wrong with you. And if you're having a heart attack, it would be cardiologist. If you're going by ambulance, you're always going to the ER, which is emergency medicine.
Scroll down on that side once, Jeremy, to D, because it showed Tracy on there. That might be the hospital one. I'm not sure.
So Jennifer, you're saying like these here, A, B, and C, these are names of individuals, but you feel like these are actual ER facilities.
Well, they're always associated with a facility. They'll have rights at that facility. That
Your
you're
clinic.
going to.
Yeah, but what I'm trying to say is that, okay, so whoever just gave me this address and they're looking for their nearest ER clinic that's in network.
It doesn't show it. It's just showing the doctor's names.
Yeah, what if that doctor, so does that mean that doctor's, if you're seeing that doctor and he's anywhere, that it's covered because it's in network? I mean, it's confusing to me is what I'm trying to say. I'd like to see if you have an ER or emergency room or emergency medicine, a list here of emergency rooms. Yeah.
Yeah, because like Slayton with our address, we have an ER here. There's an emergency room in Tracy, Marshall, Worthington, Pipestone.
Let's put
That's weird.
optometrist. So same, it just names individuals.
That's why I'm concerned about it. That's what it'd be nice to have a list of the building facilities and addresses.
Yeah, and so that's something I can work with. Hopefully, our national will figure out why is it done that way. It's hard for veterans to find in-network community providers to choose from.
It's given the provider's name and their address. Well, that one there is all the same address. That's the eye clinic in Tracy. I recognize the address and the phone number, but it doesn't give the name of the business.
Right. So up here, this should be the name of the business.
Yeah, instead of the provider's name, it should be like where the ER room is and the address, or like the optometry clinic name and the address instead of the provider's names. Is my thoughts.
Right. So just so you guys know, just
See, we're
remember.
doing community providers, so maybe that's where the catch is under the facility type.
Well, I got a question there, Jeremy, because I know that a couple of them doctors that you have on that list, they go to 2 or 3 different facilities as a doctor. So that's why I'm confused.
Try,
Yep. But I
try
think that,
urgent care once and see what comes up on that.
yeah, well, urgent care is different though. That's totally different from emergency room visits. ER is like I said, for like non-emergency situations. And this has just got all urgent care, community urgent care provider in VA's network. That's what you want, because that's what VA covers. And obviously there's nothing. There's
See, the
obviously
land of rocks and cows. We don't have nothing out here.
yeah.
Oh, boy.
But just using that as a guide point, we're so rural out here that our facilities are spaced so far apart.
Exactly. But I just wanted you guys to know that this VA locator tool is available. Just so you know, it's not the most helpful, but let's just say that you guys have a specialty care consult put into care in the community because you qualify for it. You can theoretically ahead of time look for that community provider in network, put in that specialty care consult your provider put in, type that consult in here. I just did chiropractic and I got my consult put in. So I could put chiropractic, but I could put my address, which is in the city. So it should populate a lot more here for a chiropractor in network. And there should be quite a bit, but why is this saying we didn't find any matches?
Now you're in North Dakota. You got punched in the city and state yet too.
Oh, is that what it's doing?
Yep,
Yeah,
it
right.
picked up the address in North Dakota. I was watching them now.
Let's just see if this comes up.
There you go.
Okay, so that first one up top there, Jonathan Morris, that's
Yep.
where I just got my consult and I went yesterday. So I could have looked theoretically beforehand, because when the community care provider calls you from VA, they said, hey, we got your consult from your primary care provider for chiropractic care. Where do you want to go? Well, I don't know. I don't know which in-network providers for chiropractic are available in Plymouth near me. Well, now I do, because I have this locator tool. Does that make sense?
Yeah, that makes a lot of sense that way.
So just make sure you save this VA locator. I'll send you the link to it too. This link should work. Or actually, you don't have the URL for it. I won't go into this last one because we've taken up too much time now, but this last link here is also very helpful. It compares wait times for all specialty care visits or any kind of medical appointment with VA compared to the community providers that are in network in your community. So it's kind of a helpful tool as well.
Jeremy, I've got a couple good ladies that work with me on community care from the St. Cloud Hospital, and kudos to them.
Gotcha. So I'm going to give you guys two last numbers here. And then I'm pretty much done, but I want to give you guys these last numbers here as well. So the 72-hour notification period, those phone numbers the phone number I gave you there was to VA's central reporting location, but individual VA medical centers also have facility contact numbers for care coordination in the community. So you can report your emergency care right to Minneapolis VA or St. Cloud by using these numbers. So, and you know what, Jennifer, maybe I should just email it over to you. Or I can read them off. What do you guys like?
You ready to take it?
Email them to Jennifer, and then she can send it out to everybody.
Let's do that. Just so you got them correctly. And then share them with everyone that you think of.
For all the facilities, Jeremy, Minneapolis, St. Cloud, Fargo, Sioux Falls.
Yeah. Sorry about that. I didn't have
No.
Fargo and Sioux Falls included. But I'll get all 4 of the facilities, okay?
Thank you.
All right. Well, that's all I have. I appreciate you guys attending. And if you have any questions, just email me and I'll try to do my best to answer them for you.
Sounds good, Jeremy.
Thank you.
Sounds
Thank you,
good.
Jeremy.
Thank
Yeah,
you.
good seeing you guys. I appreciate
Thank
it.
you.
Have a great night.
Okay.
You
You
too.
too.
Good to meet everybody.
Thanks, Jennifer.